This program literally saved my life. I do not think that I would be standing here right now if I didn't do this. I was barely walking. I had a huge amount of extra weight on me. I was terribly depressed, clinically depressed. Pain that was truly indescribable. 17 or something surgeries by the time I finally wound up with these guys. And I went from that to getting to the top of Mount Kilimanjaro last year.
Every person can stop the progress of the complications of diabetes. And in addition to that, you probably can reverse part of that so that you actually get better.
There not only is hope, but you can absolutely gain that control back.
We're dealing with a broken medical system. I was not taught in medical school or in my residency to treat in a preventive manner. Certainly not to treat the underlying cause of these diseases.
So many people are trapped because of the type of treatment pattern that they're in. You give somebody 10 minutes once every 3 months. What are they supposed to do?
Within the medical establishment, the physician has in mind controlling their blood sugar within very narrow limits. They can delay the onset of the awful complications of diabetes.
And so we're trained to go to that prescription pad and use it as our primary treatment.
So it's not uncommon for somebody with diabetes to be on medication for the diabetes, for a blood pressure medication, for a cholesterol medication, see their weight going up, things getting worse, but they just kind of go through the motion.
It's a never-ending kind of hamster wheel of drugs chasing bad choices.
You've got to ask yourself, what caused the diabetes to begin with?
If you can reduce the underlying condition that we call insulin resistance while your pancreas is still functioning adequately, there's a very good chance that you can get off of your medications.
Often, people try to bring their blood sugar down lower by overusing insulin, and that's just heinously wrong.
Insulin itself, in excess, is a growth hormone.
You gain weight, your cells get resistant to it. This causes many of the complications of diabetes.
Knowing that that is true, why would I want to start you on what has caused the problem in the first place?
Our program is based on scientific research that's looked into the cause. And when we address the cause, the symptoms go away.
You can stop it dead in its tracks.
Actually, the way you're feeling right now, you don't have to feel for the rest of your life.
How bad is it going to need to get before you decide you really want to take action?
I want anybody who's listening out there, and anybody I can talk to on every plane, on every bus, on every street corner, remember that some time ago, some guy said to me that I've got diabetes and I will not be a statistic. You're not a victim. This is a disease about choices.
So the question is, good health, for what? And if you can answer that question with an answer that is powerfully meaningful to you, that will give your life enough meaning to pursue with vigor.
We can help you help yourself.
And that sounds like a soundbite, but it really is true.
But it's going to take that first step.